Good afternoon. As folks are still signing in, we'll go ahead and proceed with today's meeting since I know we have a few folks to attend. So, welcome everyone to the first meeting of the Senate Committee on Health and Human Services for the 82nd Legislative Session. Madam Secretary, will you please call the roll?
Senator Lang? Here. Senator Wynn?
Here.
Senator Stone? Here. Senator Titus? Here. Chair Doniate?
I'm here. Thank you so much. Everyone is present. Madam Secretary, please indicate that all committee members are here. All right. So thank you everyone for joining us today. Today we have a few introductions. We're going to go over the adoption of committee rules and we'll begin hearing of the pre-filed bills. Before we start, I do have a few housekeeping items for all of you that I would like to make sure that we all are on the same page. So the Senate Committee on Health and Human Services is scheduled to meet at 3:30 p.m. every Tuesday and Thursday. We will begin each meeting on time, or at least try to, as folks are trickling in. The agenda items may be taken in a different order than listed. Two or more agenda items may be combined for consideration, and an item may be removed from this agenda, or discussion of an item of this agenda may be delayed at any time. If you wish to testify today, please sign in at the table by the door and provide a business card for the committee secretary. And if you do not testify, you may also want to sign in so there is a record of who is interested in a particular bill, and in the event the committee needs to contact you later. Just as if I do cut you off within the allocated time, we do recommend that you can submit all your testimony to the committee staff. When testifying, please turn on the microphones and to speak and then off to listen. We have listeners and viewers in Las Vegas and of course online, and we are recording this meeting as well. It will be available on the legislature's website later. A reminder to all those who testify pursuant to NRS 218E.085, it is unlawful for a person to knowingly misrepresent facts when testifying before a legislative committee, and a person who knowingly does so is guilty of a misdemeanor. If you have handouts for the committee, please provide 10 copies for any of those available. And of course, the exhibits can be found on the Nevada Electronic Legislative Information System. As in the past, any person proposing an amendment for a bill being heard by the committee must submit the amendment in writing no later than noon on the business day prior to the meeting, and that we ask that public comments be kept to 2 minutes each so that everyone interested in speaking can be accommodated and so that we can ensure that we can get through the agenda in a timely fashion. Again, as I mentioned, as we're going through this process, if you pass the 2-minute mark, we'll ask that you can submit the further comments to the committee staff, and that everyone please turn off your electronic devices while we go through this process. So we'll go ahead and usually, did you put committee introductions first? And then public comment starts? Yeah. We'll just. Apologies for that. We were just, I had an error just on my side. We'll go ahead and we'll start first with public comments. So if there's anyone in the room that would like to provide public comment at this time, you may do so, and then we'll have another one at the end of the meeting. So if there's anyone in the audience who would like to provide public comment, happy to do so. Seeing none, BPS, is there anyone virtually or online that would like to provide public comment at this time?
Thank you, Chair. If you would like to participate in public comment, please press *9 on your phone to take your place in the queue. Chair, there are no callers wishing to participate in public comment at this time.
Thank you so much. We'll go ahead and close public comment and proceed with today's agenda. Again, we have a public comment at the end, so hopefully, if there's anyone that would like to say anything, we'll be happy to entertain that. Okay, we'll move on to committee member and staff introductions. I would like to take a few moments to introduce members of the committee and committee staff. Members, if each of you could please introduce yourselves, please include the district you represent and your personal background. And because we're overseeing public health and public health regulations, I thought this would be a fun time if you can share your favorite restaurant and its location. So we'll start with that. And we'll begin with Vice Chair Rochelle Nguyen.
That is a lot of pressure. My name is Rochelle Nguyen. I represent State Senate District 3. It is in the heart of central Las Vegas, and it does include a good portion of the medical district. I'm very proud to serve. This is my third legislative session, but my first in the Senate, and my third time always being on the Health and Human Services Committee. So I very much look forward to continuing in this new role in the Senate. My favorite restaurant, is that what we're doing? Oh, man. It's probably Viet Noodle on Spring Mountain. I just go there with my dad, and now we have sucked my father-in-law into it as well. And I just love the food there. So I would probably say that.
Thank you so much. Senator Lane?
Okay. I'm technologically challenged. I'm Roberta Lang, and I represent Senate District 7 in Las Vegas. So Senate District 7 is on the east side of Maryland Parkway of UNLV and goes kind of all the way out to the Wash. This is my second session at the legislature, and my favorite restaurant is in my district, and it's called Am Lee. It's a Chinese cuisine restaurant. It's delicious.
Thank you so much, Senator Lane. Senator Titus.
Thank you, Mr. Chair. I'm Senator Dr. Robin Titus. I'm a medical doctor, family practice doctor, went to University of Nevada School of Medicine in the second four-year graduating class. I'm an old doctor. I graduated in 1981, did a residency in family practice. My rural county paid my way through medical school, so I'd go back and practice there, and have been practicing there for a lot of years, a little less than 40. I remained the county health officer for Lyon County, but I left day-to-day active practice. Still will make an occasional house call if called upon. I represent Senate District 17, which is pretty much the west side of Nevada, all the way. I represent all of Douglas County, so starting at South Lake Tahoe. So I represent Douglas County, Lyon County, Churchill County, Mineral County, Esmeralda County, and I go all the way down to Nye County and part of Tonopah, all of with very vast healthcare difference. As far as favorite restaurants, I don't have one. Food has never been a priority for me. My husband has to remind me that some of us do like to eat, and we need to stop and eat. And so he could tell you some favorite restaurants. For me, it's all about survival food.
Thank you so much, Senator Titus. Senator Stone.
Thank you, Mr. Chairman. It's an honor to serve with all of you on this committee. My name is Jeff Stone. I represent Senate District number 20, which includes Henderson, Boulder City, Laughlin, and Mesquite. I'm a pharmacist by profession, graduated from the USC School of Pharmacy in the same year that Dr. Titus graduated in 1981 with a Doctor of Pharmacy. I've taught at the university level, and I've owned and operated 6 pharmacies in California. And my favorite restaurant is an Italian restaurant that's been around Las Vegas for a long time called The Bootlegger.
That's great. Thank you so much. Before I introduce myself, I want to take the time to also introduce some of the staff members who are, of course, a vital part of every committee. And, I would like the chance to welcome you all to this. We have with us today Eric Robbins, who is the committee counsel. This is his 6th session and the 5th time staffing HHS. So welcome back to Senate HHS. We have Destiny Cooper, who is our committee policy analyst. This is her 1st session, so welcome to the state legislature. We also have Roberta Cox, and she is our committee manager. This is Roberta's 2nd session with the Senate as both the committee manager and legislative assistant. She was gracious enough to return back as my LA, so we're going to do good work. And we have Ms. Norma Mallet, who is one of our committee secretaries. This is Norma's 3rd legislative session and her 2nd session as the committee secretary for HHS. And then we have Mary Ashley, who is also our committee secretary, and this is Mary's first session with the Senate as a committee secretary. So thank you, staff, of course, for all that you do and all that you will do to support this committee. And I greatly appreciate everyone's restaurant recommendations. I'm a foodie at heart, so I'll make sure to stop by at all of them at least. We'll try to. My favorite restaurant is Esther's Kitchen in downtown Las Vegas. It's a good choice if you have the opportunity to stop there. So a little bit about me. My name is Fabian Doñate, and I'm proud to represent Senate District 10, which is in central Las Vegas. So if you drew a circle in the middle of Las Vegas, that's pretty much my district. I was appointed to the legislature last session and was formally elected in 2022. And, my story is, I started off in this space from a personal experience. When I was a teenager, I had to translate for my dad when he was diagnosed with type 2 diabetes. I saw that as a failure of our system. I felt that my family deserved more, and that was the reason why I chose to study public health. And, outside of the legislature, I serve as a health administrator in primary care, and I have the opportunity to see the disparities front and center of what our community experiences. And, I get the chance to interact with patients that desperately need help. And now I'm honored to help them and dictate how we respond as a state to fix those areas. And, I thought a lot about what I wanted to say to start us off today. And I think the most profound thing that I can share with you all is, throughout this pandemic, we know that many folks have been left behind, and we could have done a little bit better in certain scenarios. We know that there was a lot of lack of resources and coordination between one another. And our job is, to look on how we can move forward. And although we are currently in the recovery stage of this pandemic, I believe that our work as a committee should be carried with a sense of urgency and seriousness that reflects our ongoing resilience to not repeat what we experienced through COVID-19 ever again. What we do today and moving beyond to serve the patients of East Las Vegas should be the same attention that we direct to Eureka County. I think that we need to prioritize our efforts and direct our attention to the populations that have been overlooked or left behind in the state. And if we focus on that, we will be better equipped to protect those who suffer the most from the health disparities that we see. And before we go on to the agenda items, let me conclude with this. When I think about my service as a legislator, as a colleague, and as chair of this committee, I reflect back to the words of my former public health professor, and it's simply this. Oftentimes, we realize that policy doesn't always meet the views of the community. It is our duty as public health leaders, or in this case, as legislators, to listen to the will of the people. And if we do it right, good policy would follow after. After all, it is called public health for a reason. It's not conditional, it's not divided, but one that aligns on the group it righteously aims to serve, which is the people. So we have a lot of work ahead of us to repair our healthcare system and to address all that is set before us in this committee. So let's get to it. So moving on, our first order of business is the adoption of committee policies, which are posted on the legislature's website. These policies are fairly standard and similar to those approved in other committees. Committee members, are there any questions regarding these? I don't see any, so I will go ahead and take a motion to adopt the committee policies for the Senate.
I'd so move.
We have a motion from Senator Nguyen and a seconded from Senator Stone. Any discussion? All those in favor, please say aye. Aye. Any opposed? With the motion of 5-0, the motion passes. We'll go ahead and move on to our next agenda item, which is our presentation of a committee brief. So our committee policy analyst, Destiny Cooper, will present the committee policy brief. So please proceed when you're ready.
Thank you, Chair. Destiny Cooper, Committee Policy Analyst, Research Division LCB for the record. As legislative staff, just a quick disclaimer, I cannot advocate or oppose any of the proposals that come before you here. I'm here to assist the chair and the members with any questions concerning policies that may arise, and I'm going to be objective and unbiased. I'm happy to introduce to you our committee brief that discusses various important measures for this session. I'm just going to give a brief overview, but the full document can be found on Nellis. The Senate Health and Human Service Committee considers numerous bills and resolutions on topics primarily related to mental health, public health and safety, behavioral health, public welfare, amongst other issues. Bill statistics from the previous session can be found in this document. During the 2021 session, 87 measures were found and referred to the committee, which is less than the previous COVID session. The veto bills from last session and the committee jurisdiction can also be found in this document. Potential issues to be considered for the 2023 session include access to healthcare, telehealth, health insurance coverage, healthcare workforce, behavioral health amongst our youth, substance abuse, public health, and much more. Relevant reports, studies, and audits can also be found here for your reference, including a brief summary of the interim study on the COVID-19 health crisis. To conclude, I am available to assist the committee and its members on any issues related to matters before the committee, and the research division is also available for any research requests. Thank you, Chair.
Thank you so much. Are there any questions or any comments? Seeing none, we'll go ahead and proceed to the next agenda item. Thank you so much, Ms. Cooper. We'll go ahead and start today with Senate Bill 4. So I'll go ahead and open the hearing on Senate Bill 4. This measure revises provisions governing certain programs to pay for prescription drugs, pharmaceutical services, and other benefits. Today we have with us Ms. Schmidt, who is Administrator for ADSD and DHHS. So, and her staff will be the ones who will present this bill. So please proceed when you are ready.
Good afternoon. Chair Donate and members of the Senate Committee on Health and Human Services, we'd like to thank you for the opportunity to introduce Senate Bill 4. Also, thanks to the audience for their interest as well. So my name is Jeff Duncan. I'm an agency manager for the Nevada Aging and Disability Services Division, and I will be co-presenting with Adrian Navarro, Social Services Chief. Senate Bill 4, it revises the provisions governing certain programs to pay for prescription drugs, pharmaceutical services, and other benefits. The intent of Senate Bill 4 is to provide the department the ability to adapt to the ever-changing pharmaceutical landscape, which in turn will lead the prescription assistance program to be more effective in addressing the pharmaceutical needs of the broader population of Nevadans. So I will now turn the presentation over to Ms. Navarro, who will walk you through the specific highlights of the bill. In addition, we'll be happy to answer any questions from the committee after our testimony. Thank you.
Thank you, Mr. Duncan. For the record, my name is Adrian Navarro, Social Services Chief with the Nevada Aging and Disability Services Division. In introducing Senate Bill 4 to the committee, I'll first provide you a brief history of the Senior and Disability Prescription Assistance Program. The Senior Prescription Program was established in during the 1999 legislative session. The Disability Prescription Program was added during the 2005 legislative session. This was in conjunction with the implementation of Medicare Part D in 2006. At that time, both the Senior Prescription Program and the Disability Prescription Program were designed to assist Medicare beneficiaries with the out-of-pocket costs for their prescription medications while in the Medicare Part D coverage gap, also known as the donut hole, as well as assisting with the cost of their monthly Medicare Part D insurance premium. Since the establishment of Medicare Part D in 2006, multiple federal laws have passed, positively impacting the overall landscape of Medicare Part D. Most notably, the 2010 Affordable Care Act, which led over time to the final closure of the donut hole in 2020. The Bipartisan Budget Act of 2018, which required pharmaceutical companies to offer the same discounts to Medicare beneficiaries as they offer other insurance providers and pharmacies, and the Inflation Reduction Act of 2022, which will cap insulin copays, limit out-of-pocket drug costs, and allow for Medicare to negotiate drug pricing directly with drug manufacturers, to name a few. As Medicare Part D has changed over time, similarly, it is important for the department to evaluate changes to the Senior and Disability Prescription Program. Utilization data alone demonstrates that change is necessary, with the average number of program members per month decreasing from 6,073 in state fiscal year 15 to 550 in state fiscal year 22. For this program to continue benefiting Nevadans, these legislative changes are being proposed. Senate Bill 4 will give the department the ability to adapt to federal and state policy changes and more effectively address the pharmaceutical needs of a broader population of Nevadans, while also increasing equity in access to prescription medications for those Nevadans most in need. I'll now walk the committee through each section of the bill and briefly highlight the proposed changes. Section 1 and Section 2 remove references to repealed statutes. Section 3 removes the requirement that the funding must be directly expended by the department. This will allow more flexibility in program design, allowing the department to also provide grants and enter into contracts or intergovernmental agreements to pay for or subsidize the cost of prescription drugs. Section 3 also removes the limitation that the funding must be used only to pay for benefits for seniors and persons with disabilities, and allows for this program to assist a broader population to include natural persons who are residents of Nevada and who meet the eligibility criteria which would be established by the department. Section 3 finally revises the requirement of the department to submit a quarterly report concerning expenditures of the program, and changing that to submitting it as an annual report. This reporting timeline aligns with other programs funded through the Fund for a Healthy Nevada under NRS 439.630. And finally, Section 4 repeals statutes relating to the specific policies and procedures of the program. This too aligns with other programs which are funded through the Fund for a Healthy Nevada under NRS 439.630. In closing, we would like to thank the committee for the opportunity to present Senate Bill 4, and we're happy to answer any questions.
Thank you so much. Committee members, do we have any questions at this time? Senator Titus?
Thank you, Mr. Chair. Can you define what a natural person is?
Mr. Navarro, we'll direct that question to our committee analyst, our policy, committee counsel, sorry.
Eric Robbins, LCB Legal. So in NRS, person is generally defined to include both individual persons and corporate persons. So when we use the term natural person, we are just referring to an individual person and not a corporation or organization.
So, and I thank you for that clarification. I'm wondering then, in the original statute, it was for seniors and folks with disabilities. So by changing the wording, it's open to all Nevadans?
Yes, that would be correct.
And it doesn't specify that they're a legal citizen of the state of Nevada, you're just in Nevada? Would that be a natural citizen, or it has to be a legal citizen of the state of Nevada?
Well, it has to be a resident of the state, so they have to have established residency here, but it doesn't require that they be any other type of person, just any individual person who is a resident of this state.
Thank you for that. And then just to follow up, if I might, Mr. Chair, just on a different subject. So if we're removing it and changing it to all natural persons in the state of Nevada, it's still going to be managed under the Department of Seniors and Disabilities, or would it be moved to a different department because it's not just seniors and persons with disabilities any longer?
So through Chair Donate to Senator Titus, we would continue to oversee the program at the Nevada Aging and Disability Services Division.
Okay, thank you. Thank you, Mr. Chair, for the questions.
Thank you so much, Senator Titus. And then it does say that the folks that will qualify for this, I believe, they must meet the criteria for eligibility established by regulation. So just want to make sure that that's clarified. Any other questions? Senator Stone.
Thank you, Mr. Chairman. This is a subject that is really important to me. I unfortunately lost my mother at 57 years old from her being a smoker, and the cancer went from lung to breast, and she passed away. So this is a tobacco settlement fund. I assume that there were certain criteria under which those funds would be spent as a part of a settlement. What I haven't seen in here, unless I'm missing it, is some nexus to treating those that are addicted to nicotine. And while that we've done a lot to reduce nicotine addiction with the advent of vaping pens and liquid nicotine products. We are seeing a whole new generation of kids and young adults that are becoming addicted to nicotine, and they watch on television and see people smoking traditional cigarettes, and we're perpetuating a cycle that is, if you look at the amount that the federal government spends just on emphysema and asthma from people that smoke from generations previous and smoking up to the state, we're talking about billions, if not trillions of dollars over the past 30 or 40 years. So where is the nexus to the tobacco settlement money to improving the health and welfare of those people that are truly addicted to nicotine? And by the way, I support the idea that we're reducing prescription costs for people, so that I want to make sure I get that across.
Through the chairman to Senator Stone, this specific statute calls out what we do with this program. There are other cessation programs funded by the department that aren't listed here today, but I don't have the knowledge to speak to them, but we could definitely get back to you with the information about our cessation programs.
Okay. Okay, thank you.
Thank you so much. Any other questions from the committee members at this time? Seeing none, we'll go ahead and move on from this item. Let's go ahead and we'll now proceed to hear testimony in support of SB 4. So just a reminder, please limit your testimony to 2 minutes each. The speakers are urged to avoid repetition of comments made by previous speakers. We will start with testimony in support from those in physical locations and then move on for anyone who has called in. Is there anyone in Carson City at this time that would like to provide testimony in support? I don't see any here. BPS, is there anyone in Las Vegas or online that would like to provide testimony at this time?
Thank you, Chair. If you would like to testify in support, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. Next, we'll go ahead and hear testimony in opposition on this bill. Is there anyone here in the audience that would like to testify in opposition? I don't see any. BPS, is there anyone virtually?
Thank you, Chair. If you'd like to testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. And last but not least, is there anyone wishing to testify in neutral on this measure? You don't see any. BPS, is there anyone virtually?
If you would like to testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. Ms. Avar, do you have any closing remarks or anything before we close? I don't think there are any closing remarks. Okay, we'll go ahead and close the hearing on SB 4. Next, we'll move on to Senate Bill 43. So I'll go ahead and open the hearing on Senate Bill 43, which makes various changes relating to services for aging persons with disabilities. So we'll go ahead and when the bill presenters are ready, please proceed.
Good afternoon, Chairman and members of the committee. My name is Dina Schmidt, for the record. I serve as the Administrator for Aging and Disability Services Division, and I'm here today to introduce SB 43. SB 43 makes various changes to the services for aging persons and persons with disabilities. The intent of the bill is to clean up language in Nevada Revised Statutes 427A related to various public bodies, strategic planning, and our community advocate program. The language will help clarify various duties within aging and disability services and our public bodies. Section 1 of the bill authorizes the governor to appoint members to the Commission of Aging who are employees or officers of city and county governments. Expanding this language from officers of these governments to include employees of city and county governments will help us to fill vacancies in our commission seats. To ensure representation of city and county governments is included in the work on the Commission for Aging. Currently, the definition is members of a governing body, and we've had a very difficult time over the last 4 years keeping those seats filled. So we believe this will help us get more applicants and more members on our commission. Section 2 of the bill removes references to outdated one-time funding and clarifies the duties of the division in relation to our strategic plan for people with disabilities in order to have more transparency. Section 3 of the bill expands language related to the duties of the Commission on Services for Persons with Disabilities. Specifically, it adds a requirement to coordinate efforts with the State Independent Living Council in line with the State Independent Living Plan. The State Independent Living Council is a federally mandated council made up of a majority of people with disabilities who are responsible for advocating for the needs of people with disabilities in our state, specific to independent living. This language will help to ensure collaboration between the two public bodies and reduce duplication of efforts. Section 4 and 5 of the bill changes the name for the Office of Community Advocates for Elder Rights to the Office of Community Advocates. The reason for this is back in 2017, we expanded the duties of those positions to include people with disabilities, and so we're simply removing the elder rights portion of that name. Section 6 of the bill broadens the duties of the Commission for people who are deaf and hard of hearing related to its strategic plan. Specifically, the revised language gives this commission the power to develop a state plan for serving people who are deaf, hard of hearing, and speech impaired, rather than a strategic plan specific to the services of the division. This allows the commission to develop comprehensive recommendations for services for their targeted population beyond those under the purview of ADSD, and is in line with their current policy priorities. In closing, we'd like to thank you, committee members, for the opportunity to present SB 43, and we're happy to answer any questions.
Thank you so much, Ms. Schmidt. Are there any questions from the committee members at this time? Senator Titus.
Thank you, Mr. Chair, and I appreciate very much the concept. I definitely understand the difficulty in filling seats on commissions and the necessity to kind of rethink who you can appoint. So certainly supportive of that. What I am questioning is the changing of the language to specifically call out the deaf, hard of hearing, or speech, and it seems like you're then eliminating other disabilities because it's not defined. Why define? Why you made the point early on why you were changing. I'm trying to look at one section of eliminating the one word, but then you put a more limiting factor by redefining the next one, and so I'm just confused how that gains you anything.
Dina Schmidt, for the record, Chair Donate, through you to Senator Titus. So really, I think what we don't explain here is we have multiple commissions that do. We have a commission that serves Commission on Aging, Commission on Services for Persons with Disabilities, Autism Commission, multiple that are specific. And the way this was written is that the Commission for the persons who are deaf and hard of hearing had to do a broader. This gives them the ability to be more specific, just like all of the other commissions do.
So that lends me then
helps.
to the follow-up where maybe we have too many commissions because then everybody's in these silos, and it's not uncommon that a person with one disability has another disability. And so I'm worried that we are now even more siloing these persons with disabilities. And I like the broader title. You know, when somebody's a senior, there's a definite definition. I fall in that category by age, and you know, disability can fall under many. That umbrella covers a lot of folks. And then my concern is when you tease out yet another disability, or however they would define it, limitation or hurdle, however, then it's, and they may or may not look at it as a disability per se, but now you're defining it in one, again, in a silo. So I have concerns about using that as a pathway. I'm not sure it gains us anything. Just a comment, question.
Did you want to respond, Ms. Schmidt?
Sure, that'd be great. Dina Schmidt, for the record, thank you. Chair Donate, through you to Senator Titus. So we've had this conversation in our agency a lot too, right? Is how many commissions and boards are appropriate? But what we find is that when you only have one, it's too broad and people's voices aren't heard, because there's a lot of crossover. And what we try to do with each of these strategic plans is identify the crossover areas when we prioritize but we also, having various commissions and boards and voices heard, we hear the more intimate details of the challenges faced by different populations. I can't give you any examples off the top of my head, but I think that allowing each of our populations to tell us what make recommendations to us, and then we evaluate those recommendations as a whole to see what we can actually move forward. And we do identify the overlap, and we train our boards, we work together. They all have strategic plans, and we identify the priorities from all of our plans and try to make sure that we're addressing the needs of all the populations. But I get the concern. It is a challenge that we face on a daily basis, and we've had that discussion, are there ways to combine some of these boards and commissions?
Right. Thank you for that. And follow up on that. I think that's where I'm getting at, to make sure that I understand that the uniqueness of each person, whatever it's labeled as or called, their individual disability is unique to them. However, whatever they recognize as a barrier for them. But now to have it, if they don't fall in one of these many commissions, I'm just worried that we're beginning to kind of slice off pieces of this pie and not have the overall view. So I'd love to see your plan. What I'm hearing from you is that you do a review of these different commissions to see where there is overlap and try to deal with that. But I absolutely understand the uniqueness of each one, and you're trying to have them have a voice. But I'm worried that at some point, it's of no return.
Thank you so much, Senator Titus. Senator Nguyen, did you have a question?
I do. Thank you, Chair. Am I just understanding this? Obviously, we have lots of siloed, more specific commissions, and there is some overlap, but there's obviously things that are very unique to each one of those commissions. And I see that this is within the NRS with this specific commission. So within the structure that we have, short of Senator Titus perhaps bringing a bill to consolidate some of these commissions, does this broaden kind of that authority within the statute that it currently exists?
Dina Schmidt, for the record. Chairman Donate, through you to Senator Nguyen. I think I understand your question, and I apologize if I misunderstood, but it's really it's actually narrowing the scope for the commission, for this particular commission, so that they can identify the needs.
I'm sorry, I used the wrong word. That's what I meant, narrowing.
Okay, then yes, correct.
Thank you.
Senator Lane?
Thank you, Chair. My question is about, you had a 5-year review of the goals and the long and short-term goals, but as you change the language, when would you have a review? Because these don't live into infinity. They're always changing based on the needs of the state and the communities. So when would you do a review?
I'll get this right this time. Just Jeff Duncan for the record, through Chair Donate to the Senator. I don't have that date right in front of me when that's next due, but like any of our strategic plans, we don't want them to sit on a shelf, and we always try to make them a living, breathing document. And the councils and commissions, the advocacy bodies always bring that up, provide updates, but we'll have to get back to you on the actual date for the 5-year plan.
Yes, so do you think don't you think that should be in the law? Yeah, I mean, it doesn't have to be a date specific, but it seems like it would be a 2-year review, a 3-year review, a 5, whatever you all decide is appropriate.
So this is Jeff Duncan for the record, through the chair to the senator. We agree with that. That's something that we could definitely add to get a more specific date, if I'm understanding you correctly.
Yes, please, thank you.
Thank you so much, Senator Lane. Looking at Senator Stone to see if he has any questions. You good? Go for it.
Thank you, Mr. Chair. On the second page, line 47, section 6 of the bill abolishes the 5-year strategic plan and instead authorizes the commission to develop a statewide plan to provide services to persons who are deaf, hard of hearing, or speech impaired. What are we doing with the progress of that 5-year strategic plan that's already been underway? Are we starting from scratch again, or we certainly are concerned about this population of people, and it just seems like we're recreating a wheel.
Dina Schmidt, for the record, through Chairman Donate to Senator Stone. I apologize. I don't have my glasses. I can't see both ways. That's a great question, and really that original 5-year strategic plan had to do with what we call our Olmsted planning. And we are currently in the process of updating, I would say updating our strategic plan for the division, our Olmsted planning. So that is a 4 to 5 year plan, and we always update it, so we don't start all over. We look at what we were able to accomplish, what we weren't able to accomplish, what we need to do to move certain initiatives forward, and what are the new initiatives that have been identified in that last timeframe. So yeah, that is a constant process.
Thank you so much, Senator Stone. Senator Nguyen.
Thank you. I'm just following up on a question asked by my colleague over here. I see that we're taking out the annual, create an annual review, a 5-year strategic plan. And do the other commissions, as a part of their statutory, like, does it have that 5-year date in there as well? Or is this unique to this statute and this commission?
So it's Jeff Duncan for the record, through the chair to the senator. Not all of our advisory bodies have the same timeframes around their state plans or strategic plans, but we'd have to get back to you. A couple of them, I don't believe, have any formal plan, but we can get you a list of all of our advisory bodies and their plans. And again, that's why we have that effort to coordinate so we don't duplicate efforts as well.
So there's potentially some consistency, but not necessarily.
This Jeff Duncan for the record, that would be correct.
Okay, thank you.
Thank you so much, Senator Nguyen, for that clarification. And if you can include, maybe compare and contrast with other DHHS commissions as well and see if they even review strategic plans, I think that's helpful for us to understand from our perspective. Okay, at this time, I don't know if I don't see any other questions, so we'll go ahead and proceed to testimony for this bill. So again, we asked for testimony for this bill to be kept to 2 minutes so that everyone interested is able to speak, and speakers are urged to avoid repetition of comments made from previous speakers. And if we do end up cutting you off, just be sure that you can send additional comments to our committee staff. So we'll go ahead and start with support testimonies. Is there anyone here that would like to provide support testimony for this bill? We don't see anyone in the physical locations. BPS, is there anyone virtual?
Thank you, Chair. If you'd like to testify in support, please press star 9 on your phone to take your place in the queue. Caller, you may begin.
Yes, my name is Susan Beckett, and I would like to testify on behalf of this item. As a latent deaf, I was born hearing, hard of hearing at best, and I became deaf at age 40, and I have cochlear implants now. I am 60. I believe that this would speech impaired because of the fact that the needs of our community are changing, ever changing. If we must stick to a 5-year plan, it really holds the work of our body that represents us, the Deaf, Hard of Hearing, and Speech Impaired Commission, their hands tied to that specific strategic plan. Things are changing in Nevada, and we're working hard, or they're working hard on behalf of us. And I would just like to see this. I did make a written note, but because I was unsure if I was going to be able to speak. And just as an FYI, your closed captioning are off. So the delays, because I'm actually on a phone, I'm hearing, I just started speaking on the closed captioning side when you actually see the audio only portion of this hearing. Thank you very much for your time, everyone.
Thank you so much for your comment. BPS, is there anyone else that would like to provide public comment at this time? Oh,
Yes, Chair, there's one
testimony,
more caller.
sorry. Testimony, please proceed.
Caller, you may
Hi,
begin.
my name is Beth Jones. Oh, can you hear me?
Please proceed.
Yes, please proceed.
Thank you. My name is Beth Jones, and I'm representing myself as a parent of 2 deaf hearing children. I have involved in a variety of organizations, including the Deaf Commission, as well as serving in partners in policy making. So I'm familiar with a number of different disabilities within the space. Having said that, I would be in support of this bill to empower the Deaf Commission to use the resources they have or the lack of resources they have for adult and student disability, especially when it comes to children, because there is so much growth. Thank you very much.
Chair, there are no more callers at this time.
Thank you so much. For the last folk that was able to do their testimony, it sounded like you were cutting in and out. So to make sure that we reflect your comments accurately, if you can go ahead and communicate them to our committee staff, we would very much appreciate that. That way we can make sure that they're appropriately submitted. We don't see to have any other folks in support testimony, so we'll go ahead and move on to our next item on this part of the bill hearing. So is there anyone in opposition testimony? We don't see any opposition. BPS, is there anyone virtually that would like to testify in opposition?
If you would like to testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. And then last but not least, is there anyone wishing to testify who is neutral on this measure in this room? Don't see any. BPS, is there anyone virtually?
If you'd like to testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. Do we have any closing remarks? Nope. All right. We'll go ahead and close the hearing on SB 43. And we've arrived to the final committee item, which is an introduction of committee BDR. So, committee members, as you know, throughout the session, committees are asked to introduce bill draft requests to begin the bill process, assign a bill number, and get referred back to our committee. I just want to make sure and clarify for folks that your vote today to introduce a BDR is not an indication of your support. It's just to get the bill printed and assigned a bill number. So today, we do have 3 BDRs before us. We have BDR 40-333, BDR 40-334, and BDR S-336. These BDRs are reflective of the work that we did throughout the interim. So we should be fairly familiar with seeing them. My staff did pass them out to you, and if you need me to, I can share a brief synopsis, but I believe all of you should have received it already. So if there are any questions, I'm happy to entertain them at this time. Senator Titus.
Thank you, Mr. Chair. I understand, and just for clarification, that if we vote to send this out of the committee today to submit these bills, that doesn't mean that we will be supporting them when we get the hearings on those, so that, just to make that clear. But I do have a question on one, on the BDR 336. And I couldn't see in that, this is a telehealth bill, and question whether, because it's just 2 paragraphs of a much longer section, whether the rest of the, and I can't remember if it's in statute, if the provider of telehealth, number one, had to have a license, be a licensed Nevada physician, number one. Maybe Eric could share that with us. And number 2, if they had to have an established doctor-patient or provider-patient relationship. And number 3, if they have to have a brick-and-mortar facility in the state of Nevada. So those 3 questions I would have, if that is somewhere I'm not seeing, or if they wouldn't have to have those.
Well, go ahead and let our committee counsel.
Eric Robbins, LCB Legal. So basically, these bills, or the sections just require the insurers to pay the non-federal share of expenses for services provided to a person through telehealth to the same extent, and except for audio-only interaction in the same amount as though provided in person or other means. So basically, there's the sections that this bill would be extending don't prescribe any requirements. However, a person could not provide telehealth services under conditions that are not, it wouldn't be covered if they're not doing it in accordance with state law. So if it's something that they have to be licensed for, which currently is if they're rendering a diagnosis or managing the treatment of a patient, and that's, I believe, NRS 629.515, and they don't have a license, then it wouldn't be covered.
Thank you so much. Okay, and just for clarification again, this is not the vetting of the bill, which we will have the opportunity to do so throughout this session. We just wanted to, this is just the formal introduction of them, so it's not in support or in favor or against the bill. So it's just a procedural that we have to follow. Any other questions before we continue? Seeing none, Senator Stone.
Thank you. Also technologically challenged. I'm new to the legislature here, so again, I appreciate the fact that this doesn't bind us to a vote for a particular BDR, but is recommendations that we make here at the dais, does it effectuate the language that's going to be implanted into the bill?
My understanding is no, but this is, again, just a part of the formal proceedings of introducing BDRs of the work that we did during the
Okay, so it's basically just a launching mechanism, but there'll be plenty of time to vet and amend. And okay.
That's correct. Yeah.
Thank you. I appreciate the clarification.
Thank you so much, Senator Stone. At this time, I'll go ahead and entertain a motion to introduce BDR 40-333, BDR 40-334, and BDR S-336.
I'd so move.
Thank you so much. We have a motion from Senator Nguyen. Do we have a second? We have a second from Senator Lang. Any discussion? Any questions? Nope. All right. All those in favor, please say aye. Aye. Any opposition? Any abstentions? With a vote of 5-0, the motion carries. Thank you so much. We'll go ahead and proceed with the last agenda item today, which is public comment. If there's anyone here that would like to provide public comment, you may do so at this time. And just a reminder, to please limit your comments to 2 minutes each. Is there anyone in Carson City who would like to provide public comment at this time? We don't have anyone. BPS, is there anyone virtually?
Thank you, Chair. If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. We'll go ahead and close public comment. Members, are there any comments before we adjourn today's meeting? Senator Stone.
I just want to say, Mr. Chair, it's an honor to serve with you, and it's an honor to serve with all the fellow committee members here today. I look forward to working cooperatively with all of you to enhance the health and safety of all the residents of the state of Nevada. Thank you for allowing me to be on this committee with you.
Thank you so much, Senator Stone. Any other comments for any of the committee members? Seeing none, we'll go ahead and adjourn today's meeting. Just as a reminder, our meeting for this Thursday has been postponed. We'll be posting the agenda for that fairly shortly, and we look forward to seeing you all next week. So thank you so much for joining us, and the meeting is now adjourned.